It's important to know that we do treat children that are days, weeks, maybe even only months old that are having issues with a tongue tie, or as I like to call it, a restrictive tongue that is symptomatic. Oftentimes we see parents that have baggy eyes, can't sleep really well, they're having to feed way too long, over an hour of feeding, or sometimes their infant is keeping them up all night because they're not able to sleep well from this really, really tight tongue. So handling the emotions of the parent is super important for us at Rising Stars. We want to make sure that you're comfortable with the procedure that we recommend and that, well, your infant is better off for it. There's a term we like to call, which is treating the parental dyad. So what does that dyad mean? Well, it's two people are involved in a dyad. We have a mom who's having issues. Sometimes we're having issues with the breast. Sometimes the baby's biting the nipple, causing a lot of severe toe curling pain. And sometimes the baby's having a problem where they can't feed, can't gain weight. So we got to treat both, really. And sometimes you treat the baby for the benefit of the baby. Sometimes you treat the baby for the benefit of the mom, and vice versa. Sometimes you have to do things in this dyad to take care of both. And it's important to be aware of that, cognizant of it, and understand that it's an okay reason to treat a tongue tie for that reason. So what are the benefits with using a laser for a tongue tie, lip tie, cheek tie release? It's a great question we get quite often, actually. We have different tools at our disposal as practitioners, as oral health providers. Back in the day, believe it or not, midwives actually used to release a tongue tie with a really, really sharpened pinky nail. Now, I'm happy to report we've come a long way since then, and no pinky nails are allowed to be used. Instead, we use two different types of lasers. We have both a Solea CO2 non-contact laser. What that does, it allows us to release the tissue, do a frenectomy procedure to get better outcomes with less bleeding, a quicker procedure, often only taking a few minutes or seconds even sometimes. And the healing is just beautiful. Now we also have a diode or contact laser. It's a different type of laser which actually touches the tissue. Same outcome though. You get really good results, minimal bleeding, and fast recovery. So those are the different benefits of using a laser instead of a pinky nail for a frenectomy. So how do we take care of tethered oral ties or tongue ties at our practice at Rising Stars Pediatric Dentistry and Orthodontics? Well, we like to have 3 visits. The first visit is the initial consultation. During this visit, you'll spend time with either me, Dr. Boom, or my friend, Dr. Coco, and we'll really deep dive your child's problems. You know, if you have an infant, maybe 1 or 2 years old or younger, we have a very specific form where we're looking at, are you having problems when, gaining weight? Is there a shallow latch? Is your baby gagging or choking when eating? Different kinds of questions. But we also have a different form to discuss about if you have a child. Maybe you bring a 7, 8-year-old to us, and they're having difficulty with speech, and maybe they're tripping up on their words, or maybe they can't pronounce certain sounds like R's and S's and T's, or maybe the bilabial sounds. If you have a lip issue, sometimes you can't make sounds like the letter B, P, or M, where your lip have to come together. Or maybe you have a teenager that's having an issue where the 2 front teeth just can't come together because the tissue is just too tight. Or the tongue just can't stick out and we're having difficulty eating harder, meatier foods that require a lot of chewing. Either way, we want to make sure we deep dive the specific problems with your child so that we can understand during that consultation what exactly they need. Now, after the consultation, our second visit is for the actual procedure. We'll allocate time to do it correctly, effectively, and comfortably for your little kiddo. And then the third visit, it's very important that we have a 1-week follow-up. Why? We want to see your child back in 1 week to make sure that it's healing correctly. If it's not, we can guide on maybe we have to do a quick revision to make it heal better. Or we can just let you know that you're doing a great job. A lot of the process of a tongue and lip tie isn't really the procedure that we do. It only takes us a few minutes. It's really the aftercare that matters. So for infants, that's looking like 3 to 4 weeks of constant stretching by the parent. For a child or an adult, it's working with another therapist, either a speech and language therapist, a myofunctional therapist, that can really retrain how to use the tongue differently after that procedure. So that's kind of our process. We want to go over a consult first to make sure we know what we're doing, why we're doing it, answer all the questions you have about the procedure, and then we actually do the procedure, and then in about a week or 2 we want to see you for a follow-up to make sure that everything's healing just fine.